So I'm so excited to talk with both of you today. We got an interesting topic, which is so near and dear to my heart, more now than ever, which we'll get into in a second. But I want to talk about public healthcare versus private healthcare, and we're going to explain what that is in a second. Before I do, Dr. Klein, I'm so glad you're here.
Well, thank you for inviting
why don't you give me a brief introduction of your background, and then Tracy, we're going to do the same thing.
I'll just give you 30 seconds. Graduate of the University of California at Davis for my undergraduate. Then did my medical training at Emory and the Medical College of Georgia, and specialized in family practice and emergency medicine.
Awesome. And Tracy?
Started off life as a clinical researcher in gut health. Started St. John's, Columbia, and Northwestern. Then past 15 years I've worked in private practice as a clinical nutritionist.
Awesome.
I still do research.
Awesome. I feel inept to have this conversation with you two with all the schooling that you've had, because I haven't had nearly as much. All right, so let's talk about public and private healthcare. And why don't, Gary, help me understand when we say public healthcare, give us a brief understanding of what that is.
I think what you're referring to is the regular care that is available to the public at large. Mm-hmm. In other words, those that have insurance will go to any of the hospitals, Medicare, Medicaid, and commercial insurance.
So just about anybody, if you have a problem, you go to a doctor, you call them up. That's kind of who we're talking about is public health care.
We're talking about, again, anybody with the insurance cards, yeah. Medicare, Medicaid. There are physicians that are available for that. So you're talking about almost 95 to 98% of what's available. And the hospital systems are the same way. So it's Medicare, Medicaid, and then commercial insurance.
And then there's this private healthcare concept, in which if you're the average person out there, you're probably thinking, well, that's just for celebrities. You know, that's just for people that are super wealthy, that fly in their jets and their doctors sitting right next to them. And, you know, is that the private? Is that what we're talking about?
That, you know, it's interesting when you say that image. That's an image I think that a lot of people think. But it's really not true.
It's not reality at all.
Membership medicine really is for everyone.
Yep.
Okay. There was a time in this country when health insurance was not readily available, mm-hmm. And didn't become really a thing until around the 1960s. Prior to that, people budgeted their healthcare needs. Now, in order to explain that, things were different. The hospitals were really serving, how do I say this? You didn't have hospitals that were buying up medical practices. That's relatively in the last 20 years or so. Mm-hmm. So you had a private doc who basically would admit you to the hospital, right? Mm-hmm. You would pay the doctor, you would pay the hospital bill. The difference was that you were given time to do it. There was monthly payments, usually without an interest rate attached to it.
Wow.
That all changed.
Why can't we go back to that?
I would love to go back to that, but it's
things are really different. I mean, if you think about the public healthcare system, you know, it's chaos right now.
Yeah.
And, you know, there's so many different things I want to talk about, you know, from waiting times to quality of care, you know, down to the cost, to the financial strain of it. Let's jump into that. Like, give me the current state of the public healthcare system, Tracy. Like, where are we at? Like, when you think of, I know everybody out there is probably like super excited to talk about the big boys in the health industry.
No, and I'm actually probably between Dr. Klein and I, we both worked in both sectors, and having formerly been director of children's hospitals, I'm kind of in this good situation to speak about it. I worked in inner city hospitals, and honestly, it's a disaster. We don't have a good system for those who need it, mm-hmm. who can't afford it, and they get subpar care. And then we don't have a system that is designed or streamlined in public health care that we're helping those who have it. And then there's a whole other class of people who are falling along the wayside of, you know, the 20s to 30s-year-olds who are starting their careers, starting families. They're being failing. Our elders are being failed because they're not being given the care that they need. So from a public health stand, at no point in time, which I think you've experienced recently, are you getting a streamlined care, and hands are being tied because it's all become how many patients can you see in an hour?
Yeah.
And that's not quality care, and that's not going to be good for the entire country.
Well, the thing that I want to bring up before we go over just about any of the rest of the stuff on the public healthcare side is I feel like there's going to be almost this push in this conversation to villainize, the public healthcare system. And that's not what we're doing at all. Like,
No.
these are caring people that have good hearts for their patients. The problem is what Tracy just said. They're spread so thin, they almost have to shut their emotion off and attachment to people
100%.
because they're pulled in so many directions, and they don't have the time to do what they want to do. What their heart tells them to do, their mind's going, you can't. And that's why we feel the way we do when we walk in and we see this doctor. Unless you've been to the same doctor for 10 or 15 years, you feel like super disconnected, in the public healthcare system, because you walk in, as I don't work. I'm just the patient. So, when I walk into a hospital, I'm like, does anybody here know my name? I'm a real person. I have real concerns, and the nurses, I will say for the most part, nurses are always amazing everywhere they go.
Yes.
Because they're limited, right? They have so many patients they can see in a day and that's probably done on purpose, where the hospital's like, no. Your position, you're going to see this many people. The doctor, they're going on different floors. They're all over the place. They might be in the ER. They might be on the hospital wing. I mean, who knows where they're going to be at any given moment. And they're being paged all the time.
Yep.
And they're like, what's your name? And I'm like, you're my doctor? So there is a little bit of this, and I don't want to villainize anybody.
No.
These are awesome people that have dedicated their life to something so important.
I agree with you.
But there is a massive difference when it comes to being served by what we're calling public healthcare, which is for the masses. And then we're talking about a private healthcare system, which both of you are part of, which is not for celebrities. It is not for the super wealthy. It's for everybody. They just don't realize that.
I think your point is well taken. Again, to honor all of my colleagues, I was in that environment for a long time. It's when you get out of that environment and you realize that there's a better way to practice medicine. And when you slow down the assembly line, if you will, of how people are receiving care, then you can really start to look for the reasons that they're having these issues, rather than just, here's a prescription and see you later. So
which drives me crazy.
we're able to go back in time now and say, okay, I want to know the root cause of this. They don't have the time to do that in 15-minute increments. In 15-minute to 20-minute increments, you have the ability to just, what's the issue? Well, here's what I'm going to do. And it's usually we're going to give you this medication to cover that symptom, right? Or to take care of that blood pressure, we're going to give you this. And that's great. But the answer always is, what's causing that? Is it diet, lack of exercise, inappropriate nutrition, right, in terms of what's being taken in? Is it a combination of other things that we need to look at? And that's what we focus on. So membership medicine is really taking the time and saying, you know what, it may cost a little bit more, but I'm worth it to have the ability to have myself taken good care of by somebody who has a real vested interest in wanting to see me reach those goals.
Yeah, I agree. I mean, it's the same thing like when somebody goes mattress shopping. This is a weird analogy, but we spend a third or over a third of our life sleeping. I mean, it's probably 40% of our life. And there's certain people out there like, no, just give me whatever mattress. And then there's other people like, no. That's 40% of my life. I'm going to be on this mattress. I want to make sure it's going to be the best night's sleep possible. And, there's those mattress stores in the mall that you're like, I don't want to walk in there because that's going to be super expensive. And then there's other people like, hey, I'm going to go to Costco. And, that's kind of the difference of what we're talking about, where you're just like, not that you don't care, but you're like, it's not worth it to me. And then there's other people out there that go, no matter what the cost or whatever, like I'll sacrifice because that's that important that I'm going to spend $10,000 on a mattress versus, $1,500 at Costco.
Right.
And there's a big difference.
Yes,
I mean, taking care of yourself when you're sleeping, taking care of yourself when you're eating, it all matters with your health.
Absolutely.
It does.
And when I was just on vacation, and it's going to sound horribly judgmental, and I don't mean this to sound this way, but there's certain people, if you're a people watcher, you're just like, how could you treat yourself like that? Like, if you just feel bad, you're just like,
Yes.
there could be medical reasons why certain people walk around the way they do, but we know in America, a lot of that is gluttony. A lot of that is this poor choice management or no direction.
So I want to hug them because
Yeah.
I want to say, what is it that has caused you not to love yourself enough to do this?
Yeah.
In some ways.
It breaks my
it's
heart.
breaking my heart because and lack of education.
Yeah.
And it's really not just the United States. You go overseas. I call it, and I don't know where the term came from, but it's an appropriate term, and that is it's a globesity problem that we have, which is driving up heart disease, which is driving up so many other causes of cancer and breakdown of the body.
I mean, I'll be honest with you. I think what you do is so important because if more people could understand nutrition, I bet you our wait times would go down dramatically because how we're taking care of our bodies or how we're not taking care of our bodies. I'm thinking we're talking about wait times and how hard it is getting to certain doctors, and like, why are we so busy? Yeah. Why is everybody going to the doctor? We're not taking care of ourselves. Which we're doing a whole show on,
yes,
by the way.
There's a concept that is very simple, and both Tracy and I absolutely adhere to this. Food is medicine.
Yeah.
And what you put into your body dramatically affects the outcome of your life. It's just that simple.
Couldn't agree more.
And
good gut health is good health.
Is absolutely. That gut microbiome, which, again, 10, 15 years ago, we knew, who knew what this was? And now we realize the gut-brain axis, we understand the gut and how those bacteria and it is incredible to understand that the more diverse that is, right? So diversity in that is an incredible aspect, and yet it really is diet and what you put in.
Yeah.
It's that simple.
So how bad are wait times in the public healthcare system?
Really depends upon what you have going on. If you have an emergency situation,
Like my chest hurts. I'm in the emergency room. What's going to happen?
They're going to open up that
It's like the fast pass at Disney World, right?
It really is. You are going to be seen
Right to the
immediately. Exactly, because it can be any number of severe diagnoses. It can be anything from a pulmonary embolus to a myocardial infarction. Right. The point is, I've got to rule that out.
Yeah.
Okay. And it's they're doing cardiac enzymes. They're doing a lot of these types of testing because that's a very serious thing.
Serious.
It really
what happens
is.
on the flip side, if you don't have something serious, how bad are the wait times?
If you don't have something serious and it's just a minor, you could be waiting an hour, hour and a half, 2 hours, right?
I remember a story of Janet, who works here, went to the emergency room, was nothing that seemed serious.
Right.
They put her in a wheelchair and literally wheeled her into a closet, which she sat in there for hours before somebody pulled her out. And she was texting my wife, and she's like, I'm literally in a closet. It wasn't an actual room. They were so busy.
Right.
And it was nothing serious. And she sat in a closet for hours waiting for a doctor or a nurse or somebody to come get her.
That she knew of that was serious.
Yeah.
You know,
They did.
We've
Yeah,
been
that's
through
actually
two
a great
of those
point.
incidents in recent times.
And the other point is, as a result of this kind of behavior, what has happened in most emergency rooms is that you're vitalized every 15 to 20 minutes. In other words, somebody is going out to the waiting room to do vitals on you. Okay, so that if there is, because there was a case not too long ago where a man in a waiting room had died and he had an abdominal aneurysm, okay, and at that point, you know, we have to get serious, but you have to understand, Paul, what created the problem. What creates the problem in the emergency department today is lack of access to a primary care physician. So if you have bonded with a primary care physician, whoever that is, and you call up saying, I'm not feeling well, I have this, this, and this, well, go to the emergency room.
We've had many of those conversations.
And it really is, to me, you know, it's a situation where, unfortunately, you know, primary care has suffered because not a lot of medical students are choosing it anymore, which is a whole nother issue in and of itself coming out of medical education and the disparities of salaries and so forth in an era where student loan debt from medical schools. So there are a lot of factors, but primary care, and especially pediatrics, has suffered horribly.
Horribly. How hard is it to find a specialist or to get into a specialist right now?
You know, it's well, that's one of the benefits of being in a membership medicine kind of a situation, right? Is that, you know, we have access immediately and we're going to get you in, and you've been a part of that.
Yeah.
But in the real world, they're going to put in a referral, okay? And depending upon the severity, you may wait. I don't know. You know, the wait times can be a week, or it could be, you
months.
know,
They're months. They're months.
Or months.
We have a gal here. Her name's Tyra, and we actually think it's this building. There's something in this building that is affecting her health, and it took us a while to figure it out. I've told you about the potential mold. We don't have a mold issue, but something in this building is causing issues with her health.
Right.
So she goes, and she's deathly afraid of needles. It keeps her out of the doctors most of the time because they're like, you're going to draw blood. Every time you go to the doctor, what are they going to do? You're going to draw blood, right? So she's like, I'm not going to the doctor because I'm not having them stick a needle in me. So we finally get her up. We get her husband get involved. She finally goes to the doctor, and she has to see somebody. I don't even remember what type of doctor it is. And she started this in April. She can't see them, I think, until August.
Yeah.
Like, what if it was? She was crying in her office. It was such a hard, heavy conversation, and she's like, Paul, I think I'm gonna die.
Right.
Come to find out, like, we don't even know for certain yet, but when she's not in this office, she's fine. Something in this office is causing her a problem.
And there's a thing called a sick building syndrome, right?
That's what she thinks she has. This is so funny you brought that up. So we've literally diagnosed her on our own. No, I'm not a PhD. I don't know anything. And she's like, I think I've got sick building syndrome, you know, and she's going down the list. I'm like, stay home. She's not even here. She just works from home now.
Did you test the building for mold?
We did. And we're having it tested again.
20% of people who have genetic highlights to mold, like you and I could feel great. But let's say Dr. Klein is one of the 20% of humans that has a mold issue. They will be deathly sick.
Yeah, she's horribly sick.
Horribly. So it could be that. Could be she's sensitive to the lights.
Who knows?
Could be anything.
Could be
we're moving.
Right, but could be
can't get out of this building fast enough.
Could be the outgassing of carpeting. Could be the laminate that's used on the floor. It could be the chemicals from the night crew that's cleaning up. It can be any number of things. But you see, it would be somebody, a physician, to stop and go back and look at these environmental issues that may be affecting her.
Could even not be the building.
Exactly.
Could be something 10 years back in her history that is surfacing now.
This is such a great conversation to transition to, because I want to get away from the public, which is healthcare for everybody, right? I mean, I just use public healthcare. You can't get away from it. Even if you're a part of a private membership organization like yours, you still will have to get involved with public. I mean, they're so closely intertwined, but there's a huge difference of where your primary care physician is. Is that person associated or connected to public, or are they truly private membership like you? So help me better understand, or help our audience better understand, when we talk about membership medicine, private, and I'm calling that private healthcare, help me understand what that is. Like, we have to talk about cost yet, but like when I got introduced to you guys, which was about 5 years ago, your organization, I was at my wit's end. You know, it was for some other medical issue that I had, and I'd gone to my doctor, my primary doctor, which I haven't seen in 5 years. And, you know, he had run all these tests and everything, and he just came to a conclusion. He's like, I have no idea. Literally told me, he's like, I have no idea what's wrong with you, and gave up. And I'm like, well, I'm not giving up.
Yeah, no.
So I'd asked around and then found your organization, and I've been a member for 5 years, and it's been the greatest thing. I'm like, why haven't I known about this before? I'm no celebrity, you know, I don't have a budget like a celebrity. You know, it was the best money I've ever spent, and that I spend every single year, is to be a part of an organization like yours. So help everybody else that doesn't understand what I understand. And we're going to talk a little bit about some stories that have happened. Sure. and the benefit of having somebody like you and the access. So help me understand what it is. And I really want to talk about access, because access in the public is impossible. Can you imagine being able to talk to your doctor like when you need them, not when you want to? Like I have a huge problem, and I'm going to tell a story in a second. But can you imagine having access to a doctor when you need them at that moment? That's private, you know. So I'm giving away all the stuff. You tell me.
So,
and Trace, I want you to get involved in this too.
You know, so membership medicine really is, and I think, Paul, you've hit it, but it's not unlike somebody who needs an attorney. They're going to be paying an hourly rate, okay? And whatever that rate is, you're going to be paying it. Well, we have a rate, and this is what it is. But the point, what you're buying or what you're getting, if you will, is our time, okay? And you and I know that when you come in or you're seen or any of the patients are seen, we are spending a minimum of 45 minutes to an hour, okay, with a patient. That's just in the beginning stages, because what we're doing is we're defining what are your goals and how are we going to help you to get there.
No, before you go on,
okay,
let me help them. Let me paint a little picture.
Okay.
When you're in the waiting room and you're waiting to see a doctor, a private healthcare doctor like Dr. Klein, they'll take you back. You'll go into the exam room. You'll do whatever you're going to do. And then you know what you do? You go to their office. When's the last time you've been in a doctor's office? Like his actual private office, not the office that with the lobby and then the waiting room, or the waiting room, and then you have the, what are those called? Clinical rooms or whatever they are.
The exam room.
The exam room. And then there's the doctor off, like his personal, her personal space where their laptop is, you know? I've been in your office multiple times having conversations, you know, like it's a completely different environment where you go to an atrium, or you go to whatever healthcare is in your area, and you are in the exam room, you're in the lobby, and then you get taken back to the exam room, and you're just waiting there like, all right, am I going to see him in 15 minutes or 45 minutes? When's he going to walk? And you're listening to the steps walking by the door, you know, and then they walk in and you do the exam, and then you're done. You go right to billing, you know, you're like, it's over, you know, and then they disappear, and you're like, where does he go? You know, is he typing his notes in? And a lot of times they have that laptop or their computer in the exam room now, and they're typing notes before they walk out. And then he's a ghost, she's a ghost, you don't even see him anymore. And then you're done. It's completely different where you have multiple conversations and you're like, all right, we're not going to do any more exams. Let's just go sit down in a comfortable space and continue our conversation, because there's more to talk about.
Yes.
You know, we've looked at you, we understand now. Now let's just have a conversation. Completely different environment. And we're building what I would say is a very deep bond, a conversation, a relationship that goes beyond what you see with whatever tool you use.
You're not just a patient,
Yeah.
you know, and we really strive, and I think it's very, very important to understand this, that at a membership medicine place, if you will, an office, the goal really is for the physician to truly get to know you. The more the physician understands what you do, where you work, what your pressures are, and so forth, what your diet is, but that can only come out in the conversations that we have that occur in my office. What occurs in the exam room is the clinical, the stethoscope, the ophthalmoscope, all of that stuff which we're doing to look at things. And then as I'm putting together the pieces, I'm asking you questions, right? And that's key. That, I think, is what differentiates, is because we have the time to ask these questions instead of, well, this is what I'm feeling. The doctor then examines you. Here's a prescription, or here's a referral. See you later, bye. Whereas we're turning around and saying, okay, Paul, this is what I found, but help me to understand X, Y, and Z.
So I had a situation in December with my wife, wasn't even me. We had a situation where she just wasn't feeling right. She had been to her doctor and they had put her on some medicine, and then she had a test done. And the news we got back, they just sent the results and there was no information. And I had called your office, and this was on a weekend, and got access to the doctor almost immediately, and kind of explained the situation and shared the results. And I'll never forget what you said. I don't want to, this is on a Saturday, middle of the day, and I'm talking to my doctor on a Saturday, the middle of the day, and he's like, I don't want to scare you, but you need to take your wife to the ER right now. I don't like the sign. I don't like that result. And you said doctor speak. I don't remember that part, but I remember him saying she needs to go to the ER right now. And we went to the ER and we were panicked. I remember my wife was like shaking, and they did a CT scan. So we went from private conversation, somebody who knows me, right to the public in the ER. And my wife got medicine probably within 6 hours because we're at the ER and it was taking forever. And it wasn't a high stress situation, but the test results said, I mean, she had, the doctor in the ER said, I've never in my 25 years had never seen more bronchitis in the lung. And she had, I mean, it was like 35% of her lung was full of bronchitis. It was so bad, it took 6 months to heal. And horrible. And you're the one who's like, I want her to go to the ER right now. There's something clearly wrong with her. Her test results. I got those results from the doctor. The doctor didn't even put a note. We didn't even know what it said. So my doctor probably had, or her doctor hadn't even looked at it. They never went back into the system and said you needed to go to see any. They just posted the results.
And that was it.
And that was it. And I'm not trying to villainize anybody.
No. And I remember when I received the call, again, the concern is that the minute he had shared with me the results, at that point, I'm only concerned about his wife's safety. I called the emergency room immediately, spoke to my colleague there, so they knew that you were coming. And I kept up with knowing what was going on. It was frightening when I had heard from him, and he said, I've never seen a case like this, right?
It was scary.
It was very scary. Had it gone for even, and he and I both were talking about this afterwards, had it gone on for another day or so, it would have been
way worse.
It would have been a real major situation.
So, I really want to talk about the benefits of healthcare, and there's no better way we can do it than kind of sharing that story. And then another story that's super near and dear to my heart, because it literally happened last week. I was just in Hawaii, a 2-week vacation with my family, another really close family of ours. We vacation just about every year together. I had been dealing with a cough for about 6 weeks now, almost 7, and which I had come to see you. I went to Africa. Before I went to Africa, I'm like, I'm just coughing, something's weird. And I come into the office like, what? I kept calling, I'm like, I'm going to Africa. Their medical facilities are just a lot different. And you examine me, we chalked it up to anxiety and and allergies because there was no
At the time.
signs. Yes.
At the time, there
It was just
no,
a cough, dry cough.
Right. It was a dry cough. There was no fever. There was no
Nothing.
chills. There was nothing else in this case when we looked at
And
it.
I felt 100%.
And that was the I said, you know what? And I remember that you were also, the anxiety was also about the employee, right? Is there
Yes.
something in this
Office.
sick building
Yeah.
here that might be contributing? And here was the rate limiting step at the moment was you were just ready to go to Africa. And I said, listen, we're going to deal with this when you get back.
Yeah.
Okay, we are going to deal with it. But I said, I gave you the antibiotics, the Medrol dose pat, things that you can take with you because you're
In case
going
I
into
need it.
right. And you're going into nowhere.
So let me say that again. I'm going to Africa. I'm talking to my doctor. He examined. We chalked it up to being just an allergy. And I'm sitting in his office, his actual office, not the exam room. And he's like, here's what we're going to do. I'm going to give you all these medicines in the event that this gets worse or something else happens. You're out of the country. We're just going to have you take these. So instead of me trying to figure things out, I brought it with me. I had like 7 medications in the event of all, and you're looking at what's going on in Kenya, what sicknesses, and I was prepared for all of it. When have you ever been in a situation like that? Okay. And then I'm in Kenya. The cough was like getting worse. So I call him up and you're like, what's going on, Paul? And I'm like, blah, 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 blah. And he's like, I want you to start taking this one medicine that I had in my bag. And it actually made the cough a little bit better.
Yep.
Fast forward, I get through Kenya. The day after I get back from Kenya, I get on a plane with my family to go to Hawaii. So I was in Kenya for about 5 days. I had a day here in Charlotte, and then I'm off to Hawaii. About 6 days into Hawaii, I called him up because now there was a sign that changed.
Yes.
Now I was, and this is kind of gross, coughing up what seemed to be a blood. It was in my mucus, and it was just pink. And he's like, okay, you need to go get an x-ray. So I go from private, my doctor who knows me, and I have complete access to him.
I even sent you the facility. I want you to go to
It
this
was
facility.
like 0.3 miles from my hotel. And we go there, and he's like, this guy's examining me. He's like, you're fine, but we need an x-ray. We don't have, I'm in Hawaii. He's like, we don't have one at this facility. So at 9 a.m. tomorrow, you can go to this one. So I'm at one urgent care, go to another urgent care the next day. We actually chalked it up to the Gatorade that I was drinking Gatorade and pinky Gatorade. And he's like, it seems like it's blood. He's like, unless you're drinking some colored Gatorade. And I was like, I am. I've been drinking every day. So we thought it was that. I go the next day, take an x-ray. When he takes the x-ray, he looks like you. Just completely casual, in his doctor uniform, whatever, but he didn't have the lab coat on. We go back to take the x-ray. I'm waiting in the room. He comes back in completely masked up, shield, like he had this garment on, gloves, and I'm like, what just happened? He went from like hanging out at the beach to hazmat in like 30 seconds. And he's like, here's your x-ray, and this is a sign of, you're just in Kenya of tuberculosis, and it might not be tuberculosis, it could be a tumor, it could be cancer. All nonchalant, just says all this stuff, and my world just got thrown into a blender in literally 30 seconds. And I was like, can I take a picture of that? So I take my cell phone and I take a picture of this x-ray, and I've got a 5-centimeter hole in my lung, okay, that we thought was nothing, minutes earlier, and we're joking around, we're gonna be back at the beach, to now this doctor is saying, I want you to go to the ER. And I'm like, my first thought was, I'm texting my doctor. And then I take that picture, I immediately text you.
I get a look at that, and the first thing that goes through my mind when I see that is, holy moly.
Yeah.
I'm
probably
looking
another
at
word in
this.
there, but
Yes, another word in there, but I was really very concerned.
everybody
at
thought I
that
had
point.
TB.
It looked, initially, when I looked at that x-ray, it to me, again, common things are common things in medicine, but when you see that type of image, immediately you're thinking, number one, TB, and number two, unfortunately, a tumor.
Yeah.
Okay?
So everybody's panicked. I go to the ER, and I'm on a tiny little island in Maui, and news travels fast when they think you're a public risk to health. And I walk into the ER with my wife. The drive from the ER, or from the urgent care to the ER, was about 15 minutes, and I think we cried for 15 minutes because we're like, I have cancer. My wife's shaking again. She's like, "What? I'm scared," and I'm like, "I'm scared." And I remember we're getting ready to turn to the hospital, and I don't know why I was thinking this. This is probably not the greatest thought. And I'm like, well, it's in times like these where you have to think, is God done with me? Mm-hmm. And she looks at me like, why did you just say that? And I'm like, because I don't think he is. Like, I think we're just getting started with the ministry God's had for us, or has had for us. And, I don't know why he's allowing to happen whatever's going on in my body. And we had no answers. I'm literally like, I have tuberculosis or worse, cancer, And we walk into the ER, and it's 15 minutes. And I text you, and you're like, hey, I'm going to call the ER, which, by the way, like, right there, like, are you paying attention? I text my doctor. He calls the ER. You're on vacation. And, there's a lot going on. And there's still access, there's a relationship. And by the way, this just happened. I literally got back yesterday from vacation. This podcast's been on the calendar for months. This was not planned. And I get into the ER, I go up to the just to sign in, and the lady goes, "Are you the one from Kenya?" That's how fast that
was, and it was
traveled.
funny because what I had done was I had called ahead of time to speak to the charge nurse, and I gave a very, very brief history because I wanted the hospital to understand his background. He had just traveled from Kenya through Charlotte and now to Hawaii. Had a cough prior, okay?
Yeah.
But no symptomology, right? No fever, no chills, nothing that any concern. But what was so interesting is, they said, okay, so he was in Kenya for how long? I said 4 or 5 days, right?
Yes.
Probably not even.
But I had all my symptoms. I had my one symptom before.
But, as we were talking, the thought was a latent TB that is now active. That was one of the things.
That was a big fear.
And that was a thing that I had spoken to the ER doc and just expressed that, and he said, but once they saw the x-ray, you got to share at that point, because he was saying to me, the doc was saying to me, it was interesting, like, well, let me take a look at the x-ray and we'll take a look and so forth. And we'll, and once he looked at that x-ray,
he was convinced.
That was it.
Fast forward, I was in the ER for about 7-8 hours. Then they admitted me to the hospital. When I got admitted, this wasn't a typical admittance. I'm in, the middle of nowhere in the Pacific Ocean, where there's a strand of islands and a big fear. COVID was so big there, and they don't take this stuff lightly. And they put me in solitary confinement. Like, I'm in this 8x10 room that had a whole waiting room, like decompression, whatever. There's a steel door, and then with a window in it, and then there was another containment room, and then another door, and it had like the mesh, like where you couldn't like break out of the door. And I'm in this room, and then everybody's in hazmats. Like, they keep coming in, they didn't come in very often, but what they did, they were like completely suited up. Yep. And I feel just like I do now. And I'm just like, what is going on? And I'm texting you. I'm like, I hate to bother you on vacation, but I'm scared out of my mind. They made my wife put all this stuff on, who I was just hugging, hours earlier. And now she's being told she can't touch me. And I'm in this solitary confinement in a state in the United States that locked me up. And, I didn't feel it right away, but within a day, and I was there for 2.5 days in solitary confinement. And within a day, I started to feel that they cared more about everybody else than they did about me. But I had somebody on my side that cared more about me and was fighting the reality that I could be a real risk to society, health-wise. I have something real inside of me that has to be figured out. Like, that's my top priority. Selfishly, I want to know what's going on in my body. Unselfishly, I don't want to get anybody else sick.
Absolutely.
But unselfishly, I haven't. Like, I've had this for a month. Nobody in my circle of friends. Like, you start learning about TB and how incredibly infectious it is. I feel like it was COVID conversation. You're like, oh, you have COVID, everybody gets around you that's infected. Was that really what happened? We can debate that another time. But now we're having the same conversation. We're like, you have this highly infectious disease. Well, why isn't my wife sick? Why isn't everybody coughing? Why isn't everybody spitting up blood? Like, why am I the only one? And then you start reading, you're like, well, it takes 4 to 6 weeks to show signs. I'm like, it's been a month. Everybody around me would be sick.
Right.
So I have this war raging inside of me. I'm being held in literally solitary confinement behind bars in a hospital. And the only saving grace that I had was this angel of a doctor over here, who's fighting, he's talking to what you're going to say. Like, what were you doing as I was literally being held captive?
At that point, after re-reviewing, I kept looking at that x-ray, okay? And then I had a colleague look at it. And that colleague is a radiologist, so I had immediate access to a radiologist. So we're both looking at this, and his first statement was exactly the statement that
everybody gave me.
Right? That looks like TB, right? So, and then I said, all right, but what else can it be? Because as we started to really look at it carefully, he said, it probably, looking at this, he didn't feel that it was a tumor, okay? He just, as we looked at the architecture of this, it didn't look tumorish, if that's a word to use. But my concern was, I have a patient in lockdown for the right reason, okay? From a public health viewpoint, we're looking at, okay, we're on an island, right? And you're in an island that is a state. You've got these, islands there, but they have to protect themselves because there's nowhere to go.
Yeah, that's legit.
That was very legit. Then I got on the phone with the ID, the infectious disease doc, and this was after the testing. After 2 negative tests had come back, the gold standard being the quantiferon gold and then the sputum smear.
So quantiferon gold is blood test?
Yep.
And then the sputum is basically, they're going to test the cultures inside of your phlegm.
So what they're doing is they're inducing you to, cough up a phlegm, and then then they look under the microscope and it's plated and they're looking at it. Yep. So when those 2 came back negative, okay?
They were not letting me go.
They
were held captive.
So at that point, I got on phone with the state public health director.
In a different island.
On a different island.
Yeah.
Okay. And at the same time, I'm also on the phone at Queens Hospital, which is based in Honolulu, on the phone with a pulmonologist. Because at this point, my thinking was, we need to go in and do a bronchoscopy.
Yeah.
A bronchoscopy is when a tube is put down the trachea and it's entered into the area of the lung. The patient is asleep, and samples of that tissue were taken and then looked under the microscope. That's where I was going with this, which was the correct kind of a thing to do.
And that's what the hospital wanted to do.
And the hospital wanted to do, but we have only one problem here. They're not willing to release you yet.
No.
Okay? So there was this back and forth as to, when are they going to release now that we had these negative tests for TB. So at that point, I was on the phone with the infectious disease director saying, hey, here's the situation that's happening on this island, all right? And as I explained, 2 negative tests. We've looked at the x-ray. It's probably going to be a infectious something, is what we're thinking. Doesn't look tumorish, but the point is my patient is still being held in lockdown. And, is there any way we can speed this up? Because,
Let me paint this picture. I go into the hospital, get admitted on the weekend in an island that's on beach lifetime, and they just shut down. So all day Saturday, all day Sunday, they had all these tests and we got no results. And a lot of this is happening on Monday morning. And I'm being told, like, there's this thing called AMA. What's it stand for?
Against medical advice.
Against medical advice, which is basically, if you want to enact your own right, and the doctor in the hospital is like, you don't have any rights. He's like, if you want to walk out of here, you can walk out of here. But if we find out you have TB, we're coming to get you. Literally said it just like that. I'm like, oh my gosh.
But this was post 2 negative tests.
No,
that
was before.
Okay.
He had the worst bedside manner. And then Monday, this is all happening. He's on my doctor's on vacation. I'm on vacation, being held as a prisoner. And we get these negative tests. I'm talking to the doctor. He's talking to the state and the doctor. And Dr. Lee's the infectious doctor on staff. And she's like, well, we've never been in this situation before. And I'm like, but I'm in this situation right now. And I want to get out of here. Like, I was so at my limit. Yeah. And scared, confused. I still didn't get any answers. All that was happening, and this is the biggest difference. The public healthcare only cared about the public. They wanted to prove that I didn't have TB to release me. The concern wasn't what's wrong with me. The concern was, are you a risk to everybody else?
And it's appropriate.
It's appropriate.
Absolutely appropriate.
But it made me feel like we don't care as much about you as much as we care about everybody else. That is a weird situation to be in when, as a human being, as somebody who cares about myself, I work out, I eat well. Like a lot of what your office is, it's always been a part of me, but I've been so much better with you guys. I'm in this weird dynamic where it's like, I just want to know what's wrong with me. And I kept arguing with the nurses and the doctors, like, what if it isn't? Like, yeah, I get you want all these negatives, but why can't we do tandem tests? Like, can't we do things at the same time? Like, what if this becomes positive and this is an infection and all you want is these 4 negative? 4. They wanted 4 tests negative to get me out of here. I'm like, we're 2 in. And both tests, they're 2 different tests. And then because of Dr. Klein calling the state, calling the doctor, getting other, people's opinions, and, I don't know what, Dr. Lee walks in and she's like, and they had my 3rd sputum. They hadn't got the results back because it takes like a day. I'm like, come on. And by the way, it was $6,000 a day. It was costing me to be in this hospital. And all they wanted to do to release me was negative tests. I'm like, so I personally have to spend $6,000 for you to get an answer to release me, so then I can then spend more money to figure out what's wrong with me. Like, there's so many dynamics going on in the story. And then Dr. Lee comes in, she sits on the chair, and the first 2 times I talked to her was on the phone. She wouldn't even come in the room. And then finally, after these negative tests, talking to you, talking to everybody else, she comes in. She still hazmated up because they're still not certain, although we've got 2 negatives. And she sits down, and I'm like the beacon of health. Outside of a hole in my lung, like, they took me off of every monitor they had. Like, they had me hooked up to all this stuff over the coming days. They unhooked me from everything. They're like, well, there's nothing to monitor. Every time they came in, my blood pressure was like literally 79 over 120 or 78 over 122. Like, I'm like, nothing's wrong. My heart rate was high because I'm scared out of my mind. And, but they took me off of everything, and she sits down and she's like, I got good news for you. She's like, we're going to release you, but you have to have that 4th sputum test. And I literally cried. Like, I felt like, I even said to her, I was like, don't take this the wrong way, but I feel like you just gave me my release papers from prison, And I was so happy getting released. I sent you a picture of me kissing the ground. It really wasn't.
It was great.
But I was kissing the ground at the emergency room when I got released from the hospital. And we still don't know what was wrong with me. And I had the pulmonologist on staff walk in and say, we want to take, what's the name of the test? Bronchoscopy. And she explains it, and I was like, let's do it. And at first I was like dead set against it. And then she sits down and talks to me. She was another angel. She was awesome. I go back. It was the craziest, easy thing. I was scared out of my mind. In 20 minutes, I went from no to like laying in the room, with all these women around me, and they do this procedure, which was 15 minutes. It was nothing. And she explained it as spraying mist or saline and then sucking up whatever. She said she didn't touch anything. But I don't know. We just got results 2 days ago. That is just an infection. A simple infection. That was chaos. Literally, like it was right smack in the middle. It was the day before we were supposed to leave from one island to another. And they literally told me, you can't leave. I had to cancel everything out, tens of thousands. I mean, so much money that this whole thing cost. But the point isn't the chaos of my vacation. The point of this entire story that literally is so vivid, was the access to Dr. Klein. He's on vacation, cares so much about me. Like, I could get so emotional, but I've cried so much through this situation that I'm not emotional right now. But the fact that he cared so much on his vacation, he's calling all these places, talking to all these people. I mean, the head of state, it's still crazy that you talk to that person, and the doctor on staff. I remember one time we're on the phone, and every time I talk to him on the phone, he goes, first of all, how are you doing? Like, not what's wrong with you, how are you doing? Not how do you feel, how are you doing? Like, there's such a big difference between this type of medicine, this type of doctor versus, Mr. O'Donovan, Dr. O'Donovan walked in with no bedside manner. He's like, we're going to come and get you. Like, to how are you doing? Like, such a big difference. If I could tell every single one of you that are watching this, like, please, like, I don't know where you are, but, go find the name of their company is called Welcome.
Welcome MD.
WELL, COME, MD. There's so many. Obviously, my heart would be here, but there's so many outfits like this that are private healthcare. The costs are not that expensive, which I'll let you guys talk to in a minute. The level of care on the private side, which is membership, you pay an annual cost, which you break down, your insurance can cover it. I mean, the level of care and access that you have, I mean, coming from somebody who is literally locked into a hospital a week ago, with all these legitimate concerns, and come to find out it's just a little infection, which is so crazy. I don't know how I'd have been able to get through that. I might still have been there until I got that fourth without your intervention. And I'm literally, like, the hardest part of this whole thing was when I had to say goodbye to my wife the first night. She's in this hazmat suit, and, I'm all by myself, and she leaves me. Like, that was so hard. Like, super hard for me. And I'm all alone and, in isolation, and they don't even come in because they have to get all garbed up and they don't want to do it. So, I mean, you're literally alone, which is so difficult. And, if it wasn't for the fact that my wife kept coming back and the fact that I had somebody I know was fighting for me, that you don't get in the public health care. I mean, there might be an angel or two, and there's so many awesome things about this story. But the reality is I had a doctor fighting for me. You don't get that in the public healthcare system. They don't have time. Like, can you imagine calling your doctor while on vacation, not your vacation, while they're on their vacation? So many times in text you were kept saying, I'm fighting for you, I'm fighting for you, I'm fighting. I could show you just reams of texts because I'm scared out of my mind. And you care about me. Like, I will always know you care about me because of how you treated me over this last week. And actually, even before that, like when I was in Kenya and before I went to the x-ray and with my wife, like, I can't give you, like, I can go down a list of all the benefits. I don't need to. Like, the reality of just what happened in these two stories is the reality of what you get in the private healthcare. And this is not an advertisement, but this is such an advertisement because you deserve this level of care. Like, everybody deserves this level of care. and the cost, like what, give me a range. Like, and by the way, Tracy, I know you haven't been talking that much, but one of the things, another benefit of that, of this is you don't just get a doctor. You know, you get, there's so many different components. Every practice is different, but your office is set up in a way where it's the whole body.
Absolutely.
It's not just, hey, are you sniffly? What are your symptoms? Let's figure it out. It's, hey, let's get you super healthy. Like, let's talk about your eating. Let's talk about your weight. Let's talk about the things that are hard to work on. And that's why, you know, you're such a big part of this practice, because it's not just about, hey, I'm sick, let's get you healthy. It's like, hey, let's figure out how to not get you sick.
What makes me think about that?
That's, you know, Tracy and I always talk about the patients after each encounter. You know, one of the things that's unique about Welcome MD is that this is part of what we do. It's built into the fabric. That with each patient, the ability to have a health coach, so that we don't want patients to fail, right? Whether it's diet, whether it's exercising, whether it's a lifestyle change, you know, it's so easy to give up, right? How many people make these, what do you call it? The January 1st.
Oh,
the
resolutions.
Resolutions, right? And they make these resolutions, and by January 30th, right?
Or 3rd.
You know, and I always laugh because the club memberships that are, you'll always see them advertised. January they spike, and by January 30th, and this is interesting, the parking lot, because they look at, right? Yeah. So it really is. So our job, really, and I say this word, we're patient advocates. Mm-hmm. We're physicians, but we're patient advocates. And that's something that was taught a long time ago in medical school. Mm-hmm. You always advocate for your patient. Unfortunately, the system today that we live in makes it very, very difficult. So that's why
membership... And it's not the physician, it's not the people that work in the public.
No.
It's the structure.
It's the structure, it's the way it's all done. And quite frankly, that's why you've got physician burnout. Mm-hmm. That's why you have problems with access. So you have all of these issues. And what membership medicine really is doing is saying, you know what, there is an answer, but you have to be able to say, I'm worth it. This is important to me, to have this kind of relationship.
So help me understand, like, what do you get when you're a member of Welcome MD or the typical private healthcare, and what are the costs?
So briefly, what you're getting is access to your physician. Okay, number one. So your first step once you join is I meet with you, and we have about a 45-minute session where we're just going over your past history. Mm-hmm. I'm asking about what you do, how many kids you have, what are your stressors, what exposures that you might have had to toxic, you know, have you been exposed to asbestos? Have you been exposed? You know, we're asking all of these questions.
You're learning, yeah.
Okay? Yeah. And as we're doing this, we're learning. I'm also figuring out what kind of tests we may have to do. What are you having now? And then, of course, very ironically, which is, I think, very important, is what are your goals? Mm-hmm. What are your goals from a health perspective? You know, I love when I was calling in, sometimes I'll get your voicemail, and you have a saying that forgot the exact wording, but I love it because it determines, right? And as I tell people who are looking for membership medicine, especially at Welcome MD, is, you know, we care, number one. And number two, you're worth it, right? And that's important to understand that, because the frustration of people grinding through a system and not having the kind of relationship that you want with a doc, right? I think that's vital. The costs are it really is a one-time fee that we charge per year, okay? And that is a fee that
Does
you
it
pay.
range?
No, it's a standard
Right.
fee.
Our
that's-
fee
that's-
doesn't range, but other places, I called around before this because it's not really my purview, but I thought, let me have an answer for you. I mean, they could be ridiculously high, $6,000 a year to a couple $1,000s a year.
Yeah.
So it can be.
Depends on the private
Depends upon
office.
the private office.
And
It
I
could
think
also be monthly. If you have some insurance, if you have some savings plans, but we have patients that generally cannot afford us and come because it's important, and to pull back on the private. We want this for everybody in a sense. Like I don't bash the private or public system because I worked in it. And honestly, I think of your wife and how you were able to call about a public patient because we think of this as family medicine.
Yeah.
Like, I care about your family. I'm here because I
Yes.
care about your family. And so it's not like but everybody every doctor who has opted to go into it, and there are many that do, are doing it because they're frustrated for their patients.
Yeah.
So it's just one of the reasons.
And I think that quite honestly, the tremendous thing for me is this is not just an isolated incident with Paul. No. I have other patients that she could tell you about that this is that they find themselves in a situation where they're really in the middle of nowhere, right? Or they're on a business trip, right? So what people are paying also for is that Rolodex, if you will, of the immediacy of specialists that I have come to know through the years that I have access with, that I can get you in very, very quickly. And that's the key. And that's what membership medicine is. But that's the difference of Welcome MD. We're patient advocates. And I think that's a huge difference than some of the others. We care about our patients.
Yeah, the reality of what we're learning here and what we're discussing is, it's not for the rich and famous. They might have private healthcare physicians that they might spend $50,000 a year or whatever. And I'm sure they're out there, right? 100,000, whatever. That's not what we're talking about here. I mean, the healthcare that I receive from your office, is worth way more than I'm being charged for. And, what I just experienced, what we just went through, I don't know how I could have done that without your organization. This was never meant to be any kind of promotion or anything like that. We were just going to talk about, I wrote this months ago.
Yeah,
and we're fresh off of a crazy situation that just proves the importance of personalized membership medicine and how vital it can be.
Yeah.
And what I've been experiencing over the past couple of years has I'm a very healthy guy. I don't get sick very often. But apparently when I do, it's a big deal. And, the realities of, what I've experienced in the public healthcare system and what I have on the private side has been, literally saved my life. Like, I don't know. They might have kept me there for 5 days.
Not more.
I got out in 2.5. They were scared that I was gonna infect the island.
And when I spoke to the powers that be, the director of everything, once we had and he knew this, and it's you can do a confirmation test after confirmation. We could do 10, and we could, but when you're doing the gold standard, okay, and you're doing both gold standards, and the sputum, right, is negative, and the quantiferin gold is negative. Okay? All right, let's do it again. All right? Okay, that's fine, but we both know that the chances of a false positive at this point is really, really, right?
And when they told me that I had the 2 negatives, the way that I was told was there's a caveat. What is it called?
Quantiferin gold.
Quantiferin gold. When she's like, well, there's a caveat. We need, this, the. Was it negative? Yeah. However, when the sputum, well, it typically will take 3 weeks, blah, blah. We look for this. And I'm like, so I got 2 negatives. That's all I cared about. And they kept saying, but, what? And, and I got an advocate over here that's fighting for me, who understands their language. Like, I don't understand their language. I'm trying to figure it out as I go. And they give me all these sheets, and I'm reading, like, is there tests, what are the symptoms, blah, blah. I had like 1 of the symptoms, 2, and then you read in the test and there's like a skin test and a blood test. I'm like, I passed them both, or I failed them both, or however you say that. And they wouldn't let me go. So,
and that's where a good physician is going to get involved when he cares about his or her patients. You're going to turn around and say, okay, what are we doing now?
Yeah.
I mean, at this point,
just wasting money.
At this point now, we know it's not TB. It's got to be either another infectious. There's something infectious here, no question. All right, got to do the bronchoscopy. So what they did, so we'll know, is rather than put you and do all that other stuff, they quickly did a washing. Okay, where again she was using saline, washing around the areas, loosening up the cells, getting some of that, and then they were able to look at that under the microscope. And at that point, there you go. It's an infectious, but it's not TB.
No.
Okay, so that was really, in a way, we're done here. Okay, I pushed for the bronchoscopy because you know what, you're there. I wanted to make sure that whatever it was, we can begin treatment immediately. Mm-hmm. Okay,
and they did.
Yes,
I'm healthy. I mean, you can tell I'm not coughing anymore. Like,
and we're in the room with you.
Yes,
I don't have TB. We've confirmed that. So. How does somebody get a hold of Welcome MD?
So they just, we have a 800 number that they can call.
Their website?
And our website
we do. And just to give them an idea of a non-emergency visit, it would be, as Dr. Klein mentioned, that you would see him, and then I like to joke, then you come to me and I can explain what he's already said to you, and then we find a plan together that works for your lifestyle. There's been times, it's diet, it's exercise, it's sleep. You mentioned a mattress. I have patients, trauma, who I will literally get up out of my office, because you'll spend an hour, if not more. If I have time, you're never leaving. No, but you'll spend time with me, and I need to know you and understand you in a different way than Dr. Klein. I'm understanding you much more organically in your life, and I need to find something realistic that fits into it.
Absolutely.
You may be an athlete and you may be running 50Ks. I'm not doing that. I'm just, give me the workouts that I need to do to make sure that I don't have sarcopenia or anything like that. And there are times when I'll get up and I will advocate and push back on something that I think is important to you as a patient with Dr. Klein. And then we'll be not fighting, but discussing it in a realistic manner of, like, I think the patient needs this is why. And then sometimes I'll look at a patient and say, I think you need to do X before we could even talk about Y.
Yes.
If you're not sleeping, I can't treat you. I can't do it. Or if you have trauma, I need you to go do this. And then I'll get up, I go in to speak. There happens to be 2 Tracys in our office. So it's Tracy 1, Tracy 2, his nurse. So you only have to remember one name. And we fight for them at every time, because that's what we want to do. We're here because we want to be here, because we like our patients. I always joke, I'm going to be a skeleton in my chair. This is my retirement job. I've done a lot before that, and this is where I want to be, and I believe in this type of medicine. So, I'm not just telling you to eat your broccoli. I'm telling you a lot more about that. So then you bounce back and forth between us.
And just to be clear, the website is welcomemd.com?
Yes.
Or you got Dr. Klein.
Or drklein.com.
Well, not .com, but if you Google him, he'll come up. It makes it much easier.
But it's welcomemd.com.
It is welcome.
Which I think I've been on the website once. So, but to further your point, like, I have my annual checkups every year. It's normally in November. We do blood work. Like, it's so much different. The level of care is so much different.
This year you'll get to see me for that annual exam. I do cognitive and functional testing too.
And then what do?
Yeah.
You see me afterwards? You don't just get a note saying everything looks fine. You come back and we do what?
We go over the results.
And we go over the results.
Literally every little blood test. Like, I don't know how many different points there are on the blood test, but there's pages and pages and pages.
There's a lot.
And we'll have conversations, and some things will be, you told me the first time you saw my blood test a couple of years ago, you were like, I want these blood tests. Like there was like two things that were like, well, if you're going to be high, this is the one you want to be high. If you're going to be low, this is the one you want to be low. And everything else is like perfect. And, just the level of care, the reality that these two, there's more than just two that care about you. I'm a huge advocate clearly of this. I think everybody should look into this. You don't lose the public. I still have to use the public. You just have an advocate. You have an organization that cares about you. You have full access to them, however you want to take that. Every doctor is a little bit different. I've had 2 doctors at your organization. I've had access to their phones. Sometimes you don't get that. Sometimes you do. But the realities are, you have access to a doctor.
Absolutely.
That you can call, you can get a hold of, and they will begin the fight, whatever your situation is. Or if you don't, if there is no fight, they're like, well, we'll see you 2 days from now. Like you can get in right away. I mean, your policy is 24 hours, right?
Yeah, we see you the next day.
The next day. So, there's a situation where you're like, hey, I need to, I got this. Okay, we'll get you in tomorrow. Not in 2 weeks, not when it's over, and,
Right.
we're getting you in like right away. So there's so many benefits.
And when you come in, is there anybody in that waiting room?
No, actually, I've never actually seen another person in that waiting room. It's like me, walk in, hey, Paul, how you doing? It's not even Mr. Durso. So, I mean, you're, not that it matters, you're not a number,
No, never.
I am me, you are you, we understand each other, we have a great working relationship, and, it's important. So, as we draw to conclusion, look into private healthcare. It is important. Your body is so important to you, just as mine is to me, and how you take care of your body. You get coaches, you get people that care about you. I would go to welcomemd.com or whatever the 800 number is, or look for Dr. Klein. And that's Klein.
That's correct.
That's the way you spell his name. And so thanks. Thank you.
Thank you so much. I'm just glad you're back healthy. I really am.
When I saw you in the lobby, I was like,
But what did I say? What did I say yesterday, though? Remember, you just had land. I said, "You sure you want to be able to do this?" You just came in.
I'm shocked. I'm not jet lagged right now. I mean, I just got back from 24 hours of travel. It was crazy. I've never been on a vacation that was more chaotic. And normally, you go on a vacation, you have all these excursions, you're like, I'm going to need a vacation for vacation. This was not this one. We canceled the second week. We canceled every single one. And, I am back. Actually, when you had texted me, I was literally on the plane, just getting back. I was like, we literally just landed in Charlotte. And like, I was still on the plane. I had just activated my phone and took it off airplane mode. And then you were the first text I got. And so, yeah, I mean, literally fresh off the island. But I can't thank your organization enough, you personally, for how you've helped take care of me. And check out welcomemd.com, please. If not, find another one. So thanks.
We appreciate it so much.
This was
Thank you.
awesome.
Welcome.
Thank you for having us.
Thanks.